Hi, it's Dr. Jess coming on live here to talk about something that comes up common for NICU moms or preterm moms, and that is, what does it matter about my baby's actual age versus their adjusted age? And so the reason that we use these terms is to, one, help us understand, or mainly help us understand, where the baby who is born early should be developmentally, accounting for the fact that they would have technically still been in the womb being, growing, as opposed to being alive and expected to do certain things. So for example, my son was born 9 weeks early at 31 weeks. And so when he was 2 months old, chronologically, which is like his actual age, meaning from day one, you're counting, he was acting like a term baby at that time. So this means like his gross motor. So normally a term baby at 2 months of age is starting to do more of the social smiling and making some of the noises. Well, he was acting more like a newborn baby still. So wanting to still sleep roughly 18 hours a day. and so that's one of the main things. Social smiling. So he wasn't necessarily trying to social smile at that time, because while he was 2 months old, actual adjusted, he was like a term baby. So when we use the actual age versus the adjusted age, it's to help us to chronologically keep track of how long the baby has been alive, but to developmentally understand where they should be in terms of milestones. And so it's very important for NICU moms to understand this, so they don't compare their 2-month-old who was born 2 months early to a 2-month-old who was born term. It is a difference. It does matter. And so it's not for moms to get frustrated. It's just to have realistic expectations. So it's just like, we wouldn't expect a 6-month-old to be worried about walking, right? Because we know what's appropriate for the age. And so it's important that we understand what our premature babies are supposed to do, so we can, one, celebrate those milestones when they do accomplish their growth milestones. But then that's when we also know when, even if they're falling behind that much more, despite even more than what their prematurity allows, we allow for the appropriate help to be gotten at the appropriate time. So these are things like speech therapy, occupational therapy, physical therapy. These are specialties that can help preterm infants, and knowing where they fall in milestones will help your pediatrician to know if your baby could use some of these services to help them along. So I hope that this information has been helpful. I put a link to an explanation for those who like to read it, and there's an example there, and you can kind of plug in your baby's age and due date and things like that, and figure out what their adjusted age is. So if you have questions, or you can definitely comment on this video. If you watching the replay, put replay. But I hope that this has been helpful. Again, if you are a mom of a preterm infant, be patient with your infant and with yourself. Premature babies are strong and fragile at the same time, and it often is a uphill battle, but there are many, many, many success stories. I have 2 of my own. So if you need help or understanding anything along your